Thank you very much. Um, I would like to thank everybody for joining my webinar. I'd just like to make a couple points. First of all, this is my first webinar, although I've done multiple training and been in academia even for multiple years. It's the first time I'm actually doing it on a webinar. So I'm very, very excited, and please bear with me in case I kind of miss what I'm supposed to do in a webinar. Second point, I have everything set up on the presentation deck, but if we have some extra time, I might go over a little bit more over the ISO standard itself. I have and talk a little bit more detail on some of the changes that were implemented by the ISO standard in Switzerland. So here we start. ISO, the International Organization for Standardization, was established to share knowledge and develop voluntary, consensus-based, market-relevant standards that are designed to help innovation and provide solutions to tackle global issues. So basically, it was something that set up some years ago, a few decades ago, that said, okay, we're going to actually, something that's made in France is going to be made similar in Germany, that's going to be similar in the UK, in the United States, in Canada, in Japan. All these nations were going to send representatives, delegates to this organization, and they're going to decide on how to set up standards for various things. ISO does not only just do quality management systems and systems, for example, just for medical devices, as the ISO 13485 is, but they also do multiple other industries as well. They have one that's called the ISO 9001, which I'm sure everybody's familiar with, is a standard that's based for any organization, any type of industry. So it's a little bit more broad. So there are actually kindergartens in the EU that have ISO 9001 standard. They've been certified to that. So with this, all these countries coming together, sending delegates, currently the ISO not only is independent and international, but it has a membership of 162 national standard bodies, and they are growing. ISO established 1342 in a structured way that describes various departments and has developed requirements for medical device industry QMS. So basically what it has is a lot of the other industries have come up and said, we want specialized elements of the ISO standard just for our industry. ISO 9000 is great, but we want to actually establish something that just strictly sticks for our industry. Now, ISO, again, like I mentioned, not only does QMS for other industries, but they do other things as well too. There's ISO 14000 series, which is environmental standards. So they do more than just quality. They do more than just regulatory. They do also basically standards for various other industries. But the medical device industry really definitely needed some sort of standardization, because if you take a look at how the medical device industry has grown over the past few decades, the medical device industry is sold and produced in various parts of the world. And then actually raw materials can come from one part of the world, whereas the elements can come from, the product can actually be assembled in a third country even. Some regulatory bodies started, for example, the FDA is a great example. They have their own regulations. And so, but the regulations itself did not quite fill all of the holes that were, holes is probably not the right word, but all the elements of the regulatory compliance that an organization went to. For example, you could be a regulatory body, but what do you do about how you manage your QMS and elements like that? So they established a 1345. In 2003, they redid it, and they changed some elements of it. And in 2016, the ISO updated to ISO 1345, the 2003 standard. This reflected changes in industry and in the regulatory bodies. The standard was updated by being designed for regulatory purposes. I actually have a link right down there. I'm not going to read it out, but there's a link right down there if anybody wants to get actually the ISO 1345 current manual. And I will discuss that in the presentation as well on the ISO manual. So let's just start with a broad, this is more like a 75,000 foot edge of space almost view of what the ISO is with this slide. So 2003 versus 2016, which is actually the fundamental element of what this presentation is supposed to be. What is the space edge view of what it is? ISO organization will update standards as the industry, and in this case, regulatory change and evolve. So ISO is committed to staying up with the times. That said, they do definitely also have a global reach as well too. So they're not only trying to stay with the times in the industry as standards and everything changes within the industry, as new technologies come out, new areas come out. For example, in life sciences, not necessarily medical device, but in life sciences, there is now the individualized medicine coming out, gene therapies, which I have spent many years working on the regulatory element of that as well. And other industries are popping up as well too, and other new devices are coming out. I currently worked on a device that was actually using AI to be part of the diagnostic element of certain conditions and diseases. So the ISO standards need to keep up. And part of the keeping up also, and this time around, and we need to keep this in mind because this will come up all the time, is the regulatory element of it. Like I mentioned, multiple countries in the world have the ISO standard as part of their development into their QMS system. But on top of that, each one of them also change and evolve and also grow and all that. The standards updates include an emphasis on regulation compliance and expect the organization to meet appropriate regulatory requirements. Bingo, that is the major change in this. Although there's a lot of other detailed changes, one of the biggest changes in this is the fact that the ISO 13485 now says you need to meet appropriate regulatory requirements. What does that mean? I'll go through this presentation, maybe give you a clear view of what that means. But basically, to me, appropriate does not mean, well, I think this part of the regulatory requirement applies to us, but this doesn't. Appropriate more to me, and I think the way it's meant to be defined, is that if you are selling in the United States, you have to meet the FDA 21 CFR 820, which is the FDA's regulatory code of federal regulations for medical devices. So if you make and sell in the United States, you have to meet that regulation. If you make in the EU or Asia Pacific area or Oceania or other parts of the world, you still have to meet the FDA regulations. Okay. The update was also meant to increase commonality with the ISO standard and regulatory bodies. ISO does not necessarily want to replace the regulatory bodies because there's elements of the regulatory bodies that ISO really doesn't touch upon. And most of those are actually very specific to the country itself. I worked on a regulation that's in the Asia Pacific area, and one of the regulations needed talks about raw materials for every single element, including elements like stamps and the ink used in the stamps, where the FDA doesn't really look at that. So that's kind of the differences between the two. ISO, if they try to replace all the regulatory bodies and include every regulatory body's unique regulations into this standard, then the standard itself would become almost impossible to certify to. And the regulatory certification visits and audits would take forever. However, the ISO standard itself is a standard. It's not a regulation. What does that mean? Regulation is basically a element that is governed by law. That's a regulation. Standard is not. You don't have to make a part that meets a standard of any type. How good that would be I don't know. That probably won't be a good business decision, but again, that's an area where the ISO standard really, really doesn't look into as of an issue for them. If you don't meet their standards, you don't get certified, they just go home. And that part of it is unique as well. So my next slide is why to do the update? Well, I mentioned a little bit about it, but the basic thing is to also increase complementarity with the ISO standard. Now, when I talk about the ISO standard here, I says this is a reference to the ISO 9001 standard and the changes that it had endured. So what basically happened was the ISO 9000 standard changed from 2002 and was modified in 2008. So the old, and it has actually since changed since then. There's a 2015 version of the ISO 9001. But the old standard, the 2003, was based on the ISO 9000-2002. And the new one is based on the ISO 9000-2008. Why? Why didn't they not go to 2015 and release them about the same time with very serious commentary? At the time when they were deciding this, it was seen that the ISO 9001-2008 fit more the paradigm of the industry that was currently global. So people would have a difficult time meeting up with a lot of the 9001 updates, and then on top of that have to meet the 1345. So that's that's the reason why they decided to do that. The second reason, there's really two reasons, they're both here. The second reason is regulatory bodies. They wanted to, that's going to reoccurring theme in this whole thing. Regulatory bodies is what they wanted to include that. And I think they did a pretty unique way of doing it. And one of the things that they did was they took out the word statutory, which was kind of redundant with regulatory, and just called it regulatory bodies. And you'll see throughout the standard that you need to meet appropriate regulatory requirements. That comes up everywhere. And that is really the main reason why they made the change itself. So 2016, I think a lot more than 2003, was designed to accommodate any global standard. ISO 1345 itself was meant to do that, but I think they focused a lot on more of the Western countries, more of the EU, maybe a little bit more of the United States, but definitely kind of without really any plans, leaving out some of the other parts of the world that could actually benefit a lot. So this new update allowed it to improve convergence of the US FDA, the 21 CFR 820, Japan, and ISO requirements. So Japan is actually mentioned a lot in the update, not in the regulations, obviously, but not in the standards, I'm sorry, but Japan really did become a very important part of these regulatory bodies. One reason also is because a lot of other countries have actually followed Japan's standards instead of actually the United States FDA, especially in the Asia area, Asia Pacific area. So that is part of the requirement. So when the convergence occurred, the ISO kind of said we're going to include a way to have companies be that can follow the regulations for the FDA, Japan, and not at the same time conflict with the ISO standard itself. Also, that said, the standard was also modified to align better with the EU Medical Device Directive, MDD, needs as well. The MDD, which was the element that they put in there, the EU MDD, has actually now been replaced with what was called the MDR, which is the Medical Device Regulations. But however, the ISO, when it was in 2016, when it was released, the MDD was the one that had what European Union countries had to follow for medical device industry. The MDR just got released, I think, recently, in the past few weeks, actually, not recent. The revision was also an opportunity to converge US, Japan, and Brazil unique requirements for ISO 1345 text, making a truly global standard. Brazil is another big country that had a lot to do with setting up regulations that other countries actually, at some level or another, follow, especially in the South American region. So Brazil, which is also a large market, had their own regulations, somewhat different and from the rest of them. But the standard was said, let's try to get all these regulations, a way to get them all kind of tied in to a single standard without actually, making it difficult for a company to not follow the regulations of their own company that they're working into. This global standard, actually, there's a lot of countries out there that will actually accept 1345 itself as part of their regulations with some additions that they have themselves. So the requirement to be ISO 1345 is not mandatory by a lot of countries. Their own regulations are. That's the difference basically between a standard and a regulation. But at some point, it is highly suggested that they are, because if you follow the ISO standards, in many ways, you are actually hitting a lot of the regulatory requirements. So you're not really doing double the work. You're actually enhancing what you're doing. And then also it does state, and I will show this again in the presentation over and over again, to meet appropriate regulatory requirements. So there was also some changes that were made for other reasons, and these were incorporated in the standard. So ISO 1345-2016 also increased the awareness of the need for the following. Emphasis on competency. That's a very interesting point because we're no longer talking about training, we're talking about competency. What it means is that no longer is it enough to just say, I trained this person, they made a mistake, therefore I had a failure in the field, therefore patient died. Okay? You have to actually now prove that the person working for you in any capacity, including consultants, including vendors, including partners, everybody that's working for you as individuals are competent in working in the area that they are. I know of a lot of companies around the world that will have different requirements, for example, for engineers. I am an engineer myself, mechanical engineer, but I've run into a lot of colleagues all over the world that they have different requirements of what an engineer is. What do I mean by that? Different educational requirements, different certifications to become an engineer, different job titles as an engineer. So even in the United States, you might actually have a bunch of engineers that are not degreed engineers. There is nowhere that says you have to have a degree in any of the standards or the regulations. However, you have to prove that this person was competent. Having an engineering degree and having a job in engineering does kind of follow as an evidence of being competent. College gave him a degree, accredited college, then you have him as your engineer, and he is at one point competent. That's not enough, because he may have gotten a degree in engineering and all that and know that, but this may be a completely unique design for him or design method. You have to prove that also he's been trained, that this training has actually been evaluated, that the person trained this person themselves were competent, and the requirements for the competencies and records of that is being kept. So competency is important. I will bring that up again. We'll go through that, especially I'll talk a little bit more maybe at the end of the presentation if we have time, like I mentioned earlier, to actually discuss competency a little bit more, because that is an important element. But one of the things you have to do is you have to keep records, which is the next point, record keeping. Record keeping has been enhanced dramatically. One reason why is the regulatory bodies like records. Classic saying in life sciences, if it wasn't recorded, written down, it never happened. So if you don't have a record of it happening, a physical record, not just a memory, not just a mark on the hand, not just a post-it note, folded up somewhere. Official document that becomes a record is what they're looking for. In the past, companies could get away with, holding records of what they thought was important and just throwing out the rest. Also, the regulatory bodies, for example, want you to keep old versions of records. Um, what do I mean by that? You change a standard operating procedure, for example, work instruction procedure, whatever the organization calls it. You change that. You add an approved version of it. Yes, you do toss out the approved version on the line and the records and the master record file, all that, but you keep a version of it somewhere available of the old copies of the old procedure. Why? Because two reasons. One, to go back and see why the change was made. There is evidence to be seen in a record that change had been made, and the reasoning for that. Second reason is something that failed out in the field may not have been done on the current procedure. It may have been done on a procedure done 5 years ago, for example, and you may have changed your procedure 3 times in that 5 years. We go back to the old procedure and see what happened there. Okay, so that's, I think, an important element. I see a lot of actually, when I see a lot of companies working with different types of records, some of them are fantastic about it. I mean, world industry best standards working on their records, and some of them, oh gosh, it's like, okay, I know I have to do this, so I want to keep my records because I have to do it, but let me just do what I think is the bare minimum. I see less and less of that, which is a good thing. And there is a way in the regulations, and I'm going to speak only for the FDA for this point because I know other countries have this as well, but the FDA has a 21 CFR Part 11, which is for electronic records, electronic data keeping, electronic signatures. So it isn't like you have to keep all this data, in an old locked fireproof file cabinet. I have had to do that in my past career, but you don't have to do that. That is not the requirement today. The requirement is to be able to keep those records. And actually, there's enhancements in this new ISO 2016 that actually discusses software and how to keep records in software. Not how to, but what is basically required of that. Why do you keep records and why do you have the competency? You want to mitigate risk. Risk management is another very big element in the standard. Almost a par of regulatory compliance. What is so important about risk management? It is everywhere, risk management today. So yes, pilots have to fill out a risk management sheet before they take off in the airplane. Ships, before they set sail, need a risk management assessment done before they set sail. Generally, people in their cars have a risk mitigation system put in their cars. Those little idiot lights that people call it. That's part of the risk mitigation. Your tires are low of air. You have a potential risk of a failure of the vehicle that may cause harm or damage or both. Those are all parts of risk mitigation. Risk mitigation is to mitigate, to lessen the risk itself, which is part of risk management. There are a ton of tools for those. Risk mitigation, risk management should start from the very beginning of a company. Obviously, a lot of companies started 100 years ago or longer. You may not realize that they actually did some of this stuff. They just didn't document it. Or, it needs to be spelled out a little bit more. But today you have to have documentation that says this is part of risk management. Just to give you one quick example of a risk management tool used for a design of a product is something called the Failure Mode and Effect Analysis, FMEA, which is basically a record that says you have looked at the risks before, during, and after the design, and in the feedback from the field after the product has already been put out to the market. You have then this document that says, I looked at the failure, I looked at the occurrence of this failure, how many times do I think this is going to happen, the severity, is this going to be like, for example, no one's going to notice mild change in the use of the equipment to a nuisance, to it's going to cause somebody's death or multiple people's death. And then you have the last thing, which is criticality of the element itself. So you then divide all these numbers together. Multiply all these numbers together. You come up with a number that you say, okay, I'm going to take a look at the risks associated with this. And one of the other ones not criticality was detectability. Can I detect this failure before it actually causes any of these other things? You know, is it like really easy to detect? For example, the part won't even you could even like put it into the patient, and you know what's going to happen right there. You take a look at, for example, you open up a medical device made of steel and you see corrosion on it, or made of not steel, made of a metal, and you see corrosion on it. Right away, you know that's going to happen. Or the package is torn. You know the sterility has already been damaged. You look at, like, for example, you may have a catheter. The end of the catheter's connection to where the syringe will go into is missing, or it doesn't exist, or something of that nature, or is disconnected. So that is the tool you use. How many times that would happen? How bad is it would happen, and we'll be able to see it. You multiply these numbers. Again, criticality, and there are other things you can add to this that you find important. You come up with a number, and then you decide whether or not to tackle that problem at the design phase or some other phase of the product. That's one tool that you could use as risk mitigation for design. Other tools, you know, feedback from the field, how that is managed, all that's part of this. I cannot emphasize enough the elements of risk management in the standard and actually at regulatory bodies. Risk management is very important. And again, like I see it coming up everywhere. Actually, risk management is something that we do on a daily basis, like I mentioned, you know, with the car and all that kind of stuff. But other industries were way ahead of life sciences and medical devices in risk mitigation than in the past. So, for example, a lot of them were more aware of the need of risk mitigation as an official process in an organization than the medical device and the life sciences actually focused on. And the other one, of course, regulatory. So these three things were things that were also very heavily, the competency, the record keeping, the risk management, all of these were actually heavily enhanced in the new standard. There was other enhancements as well, too. There's, like I mentioned earlier, software. There was discussion of software, elements of the software, how that is supposed to be resolved. And again, like I said, we have some time after my presentation here that I might be able to go through some of them. But if you actually look through the standard, you'll see where there were other enhancements as well too. The session will focus on changes of the ISO 13485-2003 in relationship with the updated standard, the 2016 version. Areas covered to the session. So basically an introduction to ISO, which we've done. Introduction to ISO 1345, kind of did that. And then that's introduction to 1345-2016 is kind of the whole thing of this presentation. Introduction to ISO 1345 versus the 21 CFR 820. 21 CFR 820 is the FDA regulation. Why is that important? Why is that part of this presentation when we're talking strictly of ISO? Because I think there's a lot of overlap of the two, especially with the new enhancements. And the FDA regulation is by far the most well-known and implemented standard across the globe. The ISO 1385-2003 versus the ISO 1345-2016. Description of the changes. Again, this description of the changes is going to be like more of a 35,000-foot view. To get into description of the changes, I will again emphasize there is a lot of detail. A lot more than one sentence could have a huge meaning on how that is implemented into an organization. And the last thing, I want to talk about a preparation to start a gap analysis from the 2013 to 2016, and briefly describe, you know, the process that should be thought about as you're approaching that gap analysis and going for that. If you are currently already in the 2013 world. So a little bit more of the ISO introduction. International Standard for Organization, ISO is independent, non-governmental, international, with the membership of 169, as I mentioned earlier. In 1946, delegates from 25 companies met at the Institute of Civil Engineers in London and decided to establish a new international organization. And then the next one is very hard to see down there. Must have missed the font, but it says to facilitate the international organization and unification of industry standards for these 25 countries. And since they met in London, you can imagine that there were predominantly Western countries that did this, Western European countries, the EU and other Western European countries. In 1947, 23rd of October, 1947, the organization ISO officially began operations. So they met in I keep saying 2000, in 1946 in London, and then looks like about a year or so later, in 1947, they began operations. So that's a pretty quick element, but they did have ISO. They did have experts that come in there. Now, when I say this is ISO, this is not 1345. This is ISO 9000 that they're looking for, that they're starting to get into. Although they met in London, they actually governed by a general secretary who is located in Geneva, Switzerland. Switzerland is always known as the center of neutrality in the Western world and in the Eastern world as well, globally, most predominantly. So they established this in Switzerland. So their first major contribution to this element, again, like I said, ISO is not just 9000, not just quality systems, not just regulation type systems. They are across all industries and all business units. Like I mentioned, there's various different organizations that can become ISO certified. Certification is something else that occurred as well too, which is what actually their lifeblood is. I'm going to mention on getting a copy of the standard here in a little while, but ISO itself is ISO. They are not, part of a larger company. They do not own their own companies. They do not make a product. They do not sell you anything. They do not call up, cold calls to organizations, say, look, I got this ISO standard. Would you like to buy one? And I'll send you a certification. What they do is they have registrars across the globe. These registrars are actually tied into the ISO system through a certification process. So a certified registrar then can register you to an ISO standard. What does that tell you that you could do? Very simple. You get to use the ISO name in your organization. You get to put up an ISO flag outside. You get to put big posters inside saying we are certified to ISO 9000. You get to put that in your documentation that we're certified. That's what they're giving you. But those three letters mean large elements of the global industries across every nation, across every industry, across every organization itself. In 1987, ISO 9000 was first published. That was the very first year that ISO 9000 was a structured ISO quality management system set up for companies in the world to come back and say we can be registered and certified to the ISO standard. In 1996, okay, less than a decade later, ISO 1345 was first published, and that's what I mentioned earlier. That the medical device industry was saying, okay, we're becoming a global industry, global market, and a global manufacturing base. We need some sort of standard that I know if I'm going to go work with a company in another part of the world, we can actually talk a similar language when it comes to this area. So my introduction to ISO 1345 is this. The 1345, ISO 1345, the Medical Device Quality Management Systems. That is the official name for the ISO 1345. ISO 1345 is obviously the number of the ISO standard, but the name of it is Medical Devices Quality Management Systems. So, established, agreed to, requirements for a quality management system, a QMS, dedicated to the development, design, and production of medical devices. Okay? There is something that's not there, and that is marketing. Obviously, the end goal of an organization is to market and sell their product. ISO does not touch upon the financial elements of these, and there is a good reason why they don't. They don't because then it becomes difficult to manage at what level do you draw the line. For example, if you make a tool or a product in one country and another country has caps on pricing caps on it, the ISO standard thrown into the mix there in any form could cause more confusion than anything else, and possibly even bring up the ISO to a disrespectful area. So yes, I'm not saying money is the root of all evil by no stretch of the imagination, but it's difficult to manage that and then manage your quality management system according to the ISO standards. Global acceptance and part of the GHTF. The GHTF no longer exists. Back then, that was really what the GHTF was, a Global Harmonization Task Force. Basically, countries were throwing their experts or delegates together and trying to harmonize the different requirements of different regulatory bodies and different countries' standards and all that kind of stuff. So ISO standard went to become part of this. They were accepted into it. The Global Harmonization Task Force now replaced by a different organization that does similar elements, but it's been somewhat, I think, less significant than, for example, the ISO standard and the national regulatory bodies. Again, like I said, it's based on 9001, so that's the standard for all industries. 9001 is a very useful standard. You can have almost any organization in the world become ISO 9001 certified, including non-for-profits. So the ISO 9485 was the basis of the 1345, which made sense. And it is a standard that can be certified to. What does that mean? It means that you meet the standard. That's fine. You can meet the standard. But in order to be recognized that you do meet the standard, you have to be certified to it. That's where I was talking about earlier, where the ISO standard now has registrars. They send the registrars out there to audit your systems, depending on your organizational size and industry. And then they look at the standard. They look at what you do, documented evidence. They go out, look in your field. They look at your interaction between the different organizations, like, for example, management reviews and all that. And they certify you to. And they say, okay, you are certified. And then they come every few years to recertify you. And then when the new standard, like the 2016 comes out, you want to be certified to that. You have to be certified to that standard. And you can no longer be certified to the old one. And I'll bring that up here in a little bit. It's a value-added business tool or model. It was updated in 2016 to ISO 1345-2016. So let me really quickly briefly talk about the FDA version. International Standards Organization 1345 is a standard that organizations can be certified to, as I was mentioning. It is globally recognized and universally implemented. It was agreed to by representatives for all member countries, and a company in the United States utilizes the same requirements as the company in the EU. So all these companies that are certified to ISO 1345 do the same thing, according to the standard, what the standard covers. The International Organization for Standards is a global organization and headquartered in Switzerland, neutral area. National and Global Registrars certify organization to the standard. It is based on industry best practices for the medical device industry. It is based on 9001 structured as the old design. It is not a requirement to be compliant on a legal authority, and that's the key. 820, if you want to market and sell products in the United States, you have to meet 820. There's no way around it. If you make a medical device, if you make a life science product, you have to meet the regulations, be it 820 for medical devices, 210 to 11 for pharmaceuticals, whatever you design, you have to meet the standard for it. by law. This is a standard. 820 has some unique elements to it. I won't get into it in this one strictly because that can probably have a whole master's thesis on it. But basically, what I'm going to say is that the main difference is that you're complying under legal authority to go with the 820. And ironically, they both kind of are set up very similar in many ways if you compare the two next to each other. Well, there were some unique requirements as well between the two of them, but if you are certifying to ISO 1345 2016, you have to be compliant to 820 if you're a U.S. organization. Period. Major change. Here is what the code of here it is. The Code of Federal Regulations. Code of Federal Regulations under Title 21. There are 40 titles under the federal government. The 21 is reserved for the FDA. There's regulations and requirements that are not optional. If you have to follow everything or explain why you're not and justify it. It is not optional to be compliant. Cannot be certified to. You cannot be certified to the FDA. You can't come in there and say, hey, FDA, come in here and give me a certificate that says I'm certified to 820. It was developed from a congressional act and has a force of law. The Food and Drug Administration administers 820. FDA has regulatory to enforce the CFR. FDA is the one and only entity that can interpret the CFR, not registrars. FDA utilizes a few methods to enforce, including inspectors, compliance, and communication with healthcare providers and patients. It is the mandated authorities that define medical device mark in the U.S. It defines good manufacturing processes, but much of how is left to various organizations. Must prove compliance. The leading guidance for the medical device industry on everything until the 820 until the 1345 came out and supplemented it. So here's the major differences. 2003 versus 2016. The focus on the standards on meeting regulatory requirements. Again, that's going to come up everywhere. Regulatory requirements used 65 times in the new version. Okay? In the old version, it was 16 times. I'm sorry. Word regulatory was mentioned only 16 times in the old version. It's 81 times in the new standard. So the word regulatory is everywhere, peppered everywhere on the new standard. In the old version, it only appeared 16 times. So that's a big difference. You can see the emphasis right there by the number of words that it's being used for the word regulatory. Statutory has been removed. It's kind of implied. It's redundant with regulatory. There's emphasis on competency. I mentioned that earlier. We discussed that a little bit as well too. That's an important difference. Risk management is not required throughout the QMS. So it used to be 2003 did not. It isn't that they didn't have risk management, but it was limited to only various elements of the standard itself. Now it's every element, and the way they did that is kind of ingenious. If you read the standard, you might not even realize it's there. But a risk-based approach is needed for the control of QMS processes. So what does that mean, risk-based approach? That's something your organization has to figure out on its own. You can use industry best practices, but you have to justify how that's done. Risk management and mitigation methods, techniques to all QMS. Again, everything in the QMS system is mitigated to risk management. And the word risk is used 32 times in the standard. Again, peppered all the way across there. Last element is record keeping has been enhanced dramatically. The focus of the standards is meeting on regulatory requirements. Regulatory requirements, ISO 9000 requirements to develop a QMS that complies with ISO 1345. Okay, so 3003 said the requirement in there, which was the first few sentences, said that you had to develop a QMS that complies to the ISO standard. So in other words, the very first word is if you want to follow ISO 1345, you have to comply to it. Kind of makes sense, right? In ISO 1345 2016 difference is requirements is compliance to all regulatory and regulations and regulatory expectations. So in 2003 they said you build a QMS that complies with ISO 1345. Okay. In 2016 says okay, you need to do that as well. Add on compliance to all regulations and regulatory expectations. The standard does not state what regulations to be met, but is in the mark the devices to be used. That's an important factor. That's the reason why they put it that way. Kind of ingenious. They're just, instead of pointing out the differences between every regulation, which would have been a nightmare, they said, okay, you are in that industry. It's your responsibility to find out what those regulations are according to the market or where you manufacture, depending on how the regulation is set up. So in some countries, if you manufacture there, you have to meet the regulations. For example, if you sell in the United States and you build it, make it some other part of the world, you have to meet the 820 there as well. It's saying that the standard now must be met across the whole device. That's a huge change also. The last one is stated and emphasized throughout. This is stated and emphasized throughout the 2016 regulation standard. The focus of standards is meeting regulatory requirements. That's everywhere. Okay. Emphasize on competency, again, cannot be understated. 2003, training was emphasized. Once the one was trained, the standard was satisfied. I can't tell you how many times I've seen people sign up to do a training and just sign the paper, walk out the room. And I'm talking, this happens, and I'm not mentioning any individual organization or anything like that. And I'm not just saying the organizations I work with or for, or vendors or anything like that. I'm just saying I've seen it in other areas too, where the person just came and signed it, was trained, okay, good. And I've seen professionals. It doesn't make a difference. It's pretty prolific, or it was. In 2016, the competency now must be proven. Just beyond training, is the person competent? And you as an organization have to figure out what that means and have to figure out how you're going to comply to that. It's important. User training is also an element of the new standard. What does that mean? What's user training? User training is, if you make a medical device, okay, you can't just send it out to the field and say, here, put that on a patient for me. You have to now develop a training on how that medical device is going to be used. In other words, if you have a replacement for a certain joint in the body, it's not enough to say, okay, you're going to have to figure out how to put this thing. We made it. Our engineers put this together. But now you have to pull in these people and say, okay, we're going to teach you and show you how this is to be used as per designed. Okay? That, again, cannot be emphasized as well, too. That is an important element, an important difference in the standard. So a company now and organizations now, when they make a medical device, they have to prove that that medical device can be used and how. The focus of the standards on meeting regulatory requirements. Again, I'm overemphasizing this. No, I can't overemphasize this. Risk management, another thing I can't overemphasize. So ISO 13485, 2003, risk only applied to part of product realization. So risk, the only thing they talked about risk management was when you develop the product. You develop, and that goes back to the FMEA I was mentioning earlier, the failure mode effects analysis. That was enough as documented proof that you were looking at risk. Or it was just, a part of a very small proof package, if you will, for that. Validation was also part of that too, but that's more regulatory. Risk management was not emphasized at all. I mean, risk mitigation was not emphasized at all. Risk management was, but risk mitigation is not. So, in other words, you did not have to set up a standard that you tried to mediate or mitigated risk at all. 2013 is now a risk-based approach is needed for control of all QMS processes. Everything now has to have a risk element to it. Risk management and risk mitigation methods, techniques to all QMS. Again, cannot be underestimated. This includes outsourced processes. So if you have something that gets sent out for even like very simple basic thing, sterilization. You make a product, but you don't sterilize it in the house. You send it out to a outside company, and they sterilize the product, and they give it to you. Now, if the product itself causes a failure in the field, you can't just simply say, well, that organization sterilized it for us. It was unsterile when it got into a patient, so therefore the patient got an infection because of this. But it was, as far as we know, we sent out to sterilization. That's it. Nope, that's not good enough anymore. You have to actually say the outsourced process and mitigate the risk with them and see whether or not that is actually, is it better maybe to set up an in-house sterilization process or whatever, of course. The focus standards on meeting regulatory requirements. Again, Not enough. I can't underemphasize that. Record keeping. Record keeping has been enhanced. Records of supplier monitoring and the reevaluation of activities. That should be one sentence. Sorry. No, I'm sorry. That is not one sentence. That's not completed. So it's record of supplier monitoring. Okay, so that was what I mentioned earlier. When if you have an outsourced supplier for your product, for example, the sterilization, or like for example, raw materials coming into your facility, you have to keep the records of those of how you monitored. Did you go audit them? Did you get their documentation of their processes, of their procedures for their processes, and all that? All those records need to be kept. Evaluation of activities. So if you do something, it failed, you try to fix it and do it another way. Did you go back and reevaluate that to see that worked? Privacy regulations must be followed. This is another important element. The HIPAA rules. If you have records, are you keeping people's names, social security numbers, addresses, phone numbers? How are you monitoring that? How are you making sure that you are not breaking privacy regulations? And other global entities, other countries have different regulations according to that. Another point of record keeping is organizations must have elements in place to protect confidential health information, not just information about the patient itself, but information about the organization you're working with. For example, you may have a product, but you send it to a facility that has a unique method of how that product goes in. You need to have elements in place to protect that information as well. It's kind of basically a whole privacy and confidential health information to be honored. One thing that happened is that this change in 2016 made it more flexible for organizations to implement the standard. So what does that mean? In 2003, organizations could only exempt parts of Clause 7 in product realization. Okay, so it used to be you had to follow everything to the standard. There was elements of Clause 7, which you could look it up in the standard, and you can say, I don't need to do this. In 2016, there was an option to include parts of 6, 7, and 8 if not performed. Again, justification is necessary, but you cannot exclude them. You still need to look at your software, and software validation is defined. Software is used 25 times in the new standard. I don't believe it was used at all in the old standard. Validation and verification is expanded to include plans and arrangements, including interacting medical devices to the validation and verification inputs. So in other words, if you have a medical device that works together with another medical device, you have to validate how that interaction works. If you've looked at that, if you validated and did a verification of that interaction. The scope of standard now applies to suppliers or external parties, like I mentioned earlier. If you're going to work with another company outside, you have to include them into your standard. If they're certified to 1345 or 9000, that may be sufficient for you to work with them right away. But otherwise, regardless of whether or not they're certified, of course, you have to make that connection with them. Supplier control and outsource requirements are strengthened. Again, another part of that. Product use safety and product performance along with user training. Talked about that earlier. The product used safely. So in other words, how the product is being used in the field is to be evaluated. Can't just rely on the expertise of physicians anymore. Not that that's been that's an issue, but you have, as technology increases and grows and jumps and leaps and bounds, you have to now include also how to train the people who's going to use the product. Again, a little bit more about the changes in all this, but so the one thing that this slide influences, I've briefly put all these, so basically I put the ones that we just talked about into a little bit elements of it, but let me go over them real quick again. Product realization, design development, changes to the process, design transfer, purchasing. There's 4 new sections of purchase, supplier controls, and outsourcing requirements. Now applies to QMS service providers, including consultants. So you bring in a consultant, you have to ensure that they're competent. For example, if it's an individual. Customer complaints, how you handle customer complaints and feedback from the field. And improvements, how do you handle improvements to the product? If you have a physician that says, you know what, if this goes in this way, it would so much be a better product for me to use. Other physicians kind of agree. That's an improvement. How do you see that feedback into the design and the development? The changes in all sections of the standards are updated to the 2000 and which is now the 2016 is the third edition. So there was the original in 1996. 2003 was the first change. This is the third change. The important part of this slide is at the very bottom there, Annex A, which is outlined in the which is in the standard, actually does a comparison, side-by-side comparison of the ISO 1345, 2003, and 2016. I strongly recommend that that is one of the first places you start for your gap analysis. What does that mean? That means that that's where you, if you are already certified to 2003, you want a gap analysis. And I'm not going to hit it too much on the gap analysis. I do have a couple of slides on that, but I'm not going to hit on too much because you know, a lot of organizations already are not certified. This is the first time they're going to the ISO 1345, so they don't have a gap analysis need. A lot of them are jumping from 2000 from the 19. Well, they're not jumping from 1996, but the ISO 9000 standard, they're jumping to 1345. So, and then actually Annex B is ISO 9015 and 1345 2016 differences. So, Annex A and B, but A is the one that is, you know, predominantly part of what this presentation is about. Here is the differences in product realization. ISO 13945 2003 covered product verification, validation, monitoring, inspection, testing. Now, 2016 includes product handling, storage, measurement, validation, and traceability. What I'm going to talk about real quick is the differences. One of the things, product handling is how the product is handled. Basically, you know, how it goes from one area to the other area, and how it's stored. You know, do you store it in the appropriate conditions that it needs to be stored in? For example, if it needs to be in certain temperature, certain humidity, are you doing that? Measurements, how you're taking the measurements. One of the important things is that now the measurement tools themselves have to be validated and also enhanced to make sure that they are the correct tools. Revalidation. So if you move a piece of equipment, let's say you move a CNC machine, one of the simple machines, you move that one, you know, a meter down the line to make room for another one, you have to revalidate that piece of equipment just because you moved it for that much of a difference. Seems a little extreme, but there are regulations out there that say, yes, you need to revalidate that. There is no you know, line that needs to be drawn. Like, for example, well, if you move it 2 meters, does it make a difference? If you move it 1,000 meters, does it make a difference? If you move it across the country, does it make a difference? Yeah, something may have happened while you were moving it. It could be a sensitive piece of equipment that that's been damaged by the short move. So you need to revalidate that. Traceability. What does that mean? I make a product, send it out to the field. Something happens to the patient because of the product. They pull the product out, or they look at the product, come back, and they say, okay, this product failed, and this is the reason why. Well, how do you know if you made that, what the lot of that product was? So you can have multiple products out there that are causing failures or going to potentially cause a failure on patients. There's no way you could trace them in the past. That has been something that a lot of the regulatory requirements ask for anyway. So it wasn't that big of an issue, but it's now part of the standard. Besides just saying it, it's saying globally, you make a product, you have to be able to trace it globally. So that's where the difference is. It's not that the fact that if you were FDA, if you were, you know, meaning, like for example 820, you sold a product in the United States, 820 requires you to have traceability elements of it. So finding the documentation or the evidence or the records of the product itself was not that difficult. But now it's a global thing. So that's what the ISO standard comes into play over the 820 FDA standard. Design development. Design development inputs. Risk management inputs must be considered to clarify product. So again, risk management is an element of the input that you have to put in there. One of the changes in the standard was that risk management now had the inputs into the risk management must include risk management. And then also the output itself too. So in other words, risk management is the input, which then the mitigation becomes the output. Design and development verification validation. So this one of the changes there is verification validation plans must be verified. And the other one, you just had the plans. Okay, good, let's go. Now you guys say, okay, these plans actually meet what we're talking about. So you have to actually verify the verification plan. Sounds redundant? Maybe. But more importantly, you can't just put a plan together and say, okay, let's agree to this plan because it's, it's easy. We can do it real fast and we can get the equipment running. Now you have to justify why you did those plans. It can't just be something basic and simple. You have to actually put some thought and record and document and record those thoughts. Device that connect to or interface with other medical devices. I mentioned that earlier. So if you have a medical device that plugs into another medical device, for example, you make like for example, I'm trying to think of those blood sugar monitoring elements. You have the strips. You have to validate, verify that those strips actually can go inside the equipment. A lot of times the strips are made by the same company, but that's an oversimplified element of it. I'm also thinking, for example, you may have a medical bed. You may be making, medical hospital beds, and yet you have inputs into the records of the patient. You have to make sure those inputs work with the other company's lines and all that coming in and out of that. Design and development changes. One of the differences now from the 2016 models, the process to control design and development changes exist. You have to evaluate significant impact. Okay? So evaluate significance and impact. So in other words, if you make a change in the design and development, you have to now evaluate the significance of that change, what it did, and how different it is, and the impact it would have to the final product. Okay? And these have to be documented processes. You have to have a process now in place to be able to do this. And you have to keep records. That's another element added to the design development changes into the standard. Design development transfer. So when you have a product, for example, coming R&D into the manufacturing world, you have to now in the standard, didn't have to in 2003, but in 2016, you have to establish a specific design and development transfer subsection. So in other words, part of the design development documentation is now you have to actually have documented design transfer part of that. Where beforehand you may have had a global one for every product you make, and okay, we have this. Now it has to be specific for that individual product you're making. The differences in the purchasing processes. Focus now the supplier selection criteria on the effects of the supplier performance. Okay. So now the purchasing area now focused. The focus here on the changes were on the criteria and the effects of the supplier and the performance they have in relationship to your organization. New requirements added related to monitoring and reevaluation of suppliers. So what they're saying is that you can't just simply have an agreement, handshake, and say, all right, you're going to make a product for us, and then they make the product for years, and you never even know what happened. They've changed owners, they've changed raw materials in their product, they've changed everything, and you have a failure on the field. And then you have to say, well, they made this product for us. They made it for 25 years. We didn't realize there was a difference that they changed. It's not our fault. It's their fault, whatever. I'm not trying to suggest that to cause any blame. But the FDA would come in and say, you have a failure field. What happened? You can no longer do that. You have to constantly monitor and go back and reevaluate, re-audit them, go through their document reviews, look at their processes, see if there's any changes that they didn't tell you about. Evaluate what those changes did, the ones that they did, or if they did not, how do they affect your product? You have to do all that. And then also, part of that is you provide additional details related to the content of the records. The new standard has more issues about more elements of it, of how you record or document and record the evaluation and monitoring of your supplier base. Part of the purchasing information is that there's a new requirement to add notification of changes in purchased product. Okay, so now you have to have an active process in place with an agreement that your suppliers are going to follow this on how changes will be made in the product that you purchase from them. So in other words, it wasn't anymore a burden on the suppliers to say, okay, well, we're going to tell them if we change it or something. Now you have to have a process in place that says that actively searches out any changes and gives the supplier an easy way to send those changes to your organization so you can implement, deny, accept, discuss the changes with them. The last the verification of purchased product. New requirements added to the extent of verification activities and actions taken with the organization. Be aware of any changes in the purchased product. So basically, if you're purchasing a product, there's a change. A new requirement has been added to the standard 2016 that says you have to do a verification of the change itself and how it affected your product or your process or both, and have a documented process in place in order to do that and keep records of that. Customer complaints is another area that's been enhanced. Feedback indicates that feedback should come from production and post-production activities. They added a requirement to utilize feedback and risk management processes in order to monitor and maintain product requirements. There again, risk management. But basically, you have to get feedback from the field. If you are selling a product and you have it in patients, or you have it used with patients, or you have it used with medical personnel, you have to get feedback back and see how that product worked. And if there's a complaint, a whole new subclause has been added. What that means is it's a whole new number given to this area just for complaint handling in the new standard in 2016. And it covers this: document a procedure for timely complaint handling in accordance with applicable regulatory requirements. Again, regulations. Another thing is timely complaint handling. You can't have a complaint and then 5 years later come back and look, okay, it's time for me to look at this complaint. You have a complaint today, you start working on it today. I'm over exaggerating there, but basically it has to be timely. And you have to justify the time. If it takes 6 months, you have to justify why. And you have to document a procedure for this. It's not just another thing. You have to have a procedure. I'm going to look at this. I'm going to have 24-hour notice notification. I'm going to notify the regulatory body within 48 hours because that's their regulation. I then have to go back and talk with the failure and all that and continue on the process. Complaint is not investigated. You need to justify. So you say, okay, this is a complaint. I'm not going to really look into it. It's not that important. It's so you have to justify that. I can't really give you an example for that because that would be, interpreting this clause, and I don't want to do that. But when you run into it, you'll understand where those are appropriate or not. Again, if you justify it, then it's appropriate, right? Complaint handling records shall be maintained. You maintain all these complaint handlers. You figure out a process on how a person, if there's a complaint in the field, how they get that information for you. Do they fill out a form? Do they call you up? Does the person that gets called, does he fill out a form while they talk on the phone? All these are records, and they will be maintained. And when the FDA regulatory body comes in, they will look and evaluate your organization accordingly. When the standards auditors come in, they will evaluate whether or not you are or you are not doing it, not necessarily the content. Another new subclause in the complaints department, the ISO 1345-2016, is reporting to regulatory authorities. So they have a new subclause. They pepper it across the standard. What is the key difference? Regulatory requirements. Regulatory requirements requires notification complaints shall document procedures for providing notification. If your regulatory body says you will notify us if you have a failure in the field, if that is a requirement of the regulation of the organization of the place you're in, you will have a document that is a procedure that tells you how you're going to handle that. There's improvements. Must improve changes that have been implemented to improve the device. So, what it says that if you implement changes, you have to follow this. This was a clause that was added. The organization shall identify and implement any changes necessary to ensure and maintain the continued suitability, accuracy, adequacy, and effectiveness of the quality management system, as well as the medical device safety and performance, through the use of the quality policy, quality objectives, audit results, post-market surveillance, analysis of data, corrective actions, preventive actions, and management review. Yes, everything. Okay, they said everything. So if you implement a change, you have to go through this entire process. So I'm not going to read this all because there's a lot here. So just quickly say that 2003, a QMS that complies with ISO 1345. In 2003, that's all you have to say. I'm compliant with the standard. Everything that's written in this little book of this little piece of paper you gave me, I will comply to that. Now it says you must comply with regulations. Okay, and those regulatory requirements include statutes, regulations, ordinances, directives, and everything in there. I won't read everything in there, but that's basically some of the way it defines what regulatory requirements are within the new standards. So, as I mentioned at the last point, the ISO community now considers redundancy in the phrase statutory regulatory, and so that's no longer used and replaced with just regulatory requirements. Timeline for implementation. This is more not a timeline anymore. It's more of a history. In March 2016, the standard was published. The 2016 was published. In March 1st of 2016, when it was published, to March 1st of 2019, which was a few days ago, there was a 3-year transition period. So they gave you that time to update your QMSs to the new standard. 2016 again to 2018. If you're a new organization that you want to get into the ISO standard, you want to get into ISO 1345, you have to be certified to 2016. And so after March 1st, 2018, to just a few days, it doesn't make a difference if you were going to go, if you had to be recertified from your old ISO 2003 version or whatever, only certified to the ISO 2016. Also, on March 1st, 2019, just a few days ago, Worldwide Industry Compliance Certification to ISO 2016 was required. The white paper I have there is, again, another link that you can follow to figure out, find out a little bit more about how that was all done. Okay, quick thing about GAP. First thing. Obtain a copy of the 2016 ISO 1345. Official copy. Don't go borrow one from a colleague in another company. Get your upper management to buy official copies. That is how the ISO organization funds itself. It's the purchasing of their documents, of their standards. Buy it. If you have one, you have a registrar that comes in there and can't find an officially bought copy, it may cause you some problems. A GAP. What is GAP? It says that there's holes in your QMS from the 2003 model version that you were following and you were very good at to now the 2016 that you need to follow. Okay, that's what a gap analysis is. It's a process to determine the missing elements. You design your custom gaps. So every organization. So I can't sit here and put together a little template for you. Every organization has to have their own custom version of a gap analysis. So you develop these documents. You develop a template for the gap, a checklist for the gap. You do your entire overall QMS system, not just for sections and sections of that. You will see how they integrate better into 2016 version anyway. So you do the overall, and then you go back and make sure the individual ones follow it as well too. Okay, so you look at the overall. Does the overall, what's missing in my overall 1345 to the individual, each process itself. So one for corrective actions, one for design development, and all that. Review of current documentation process. So you also look at all your documentation, your processes, what you have in place, what procedures you have in place, what records are you keeping. And then you update the process change that complies with that. So you look at your process, you say, you know what, this meets it, except I just need to add this small element to it, and it'll meet it. Okay? Or you say, this process doesn't come anywhere close to 2016, I got to toss it. Or I don't have anything for customer complaints, I need to add that into my processes. And then you update the ones that are actually compliant. So if you have some that are compliant, you go back and you evaluate to make sure that they are truly in compliance and there's anything missing. You implement process changes that are compliant with the new one. So you implement them. Okay? It's not enough just to say, all right, I have to do all this, do it. You have to actually implement them into it, into your process, into your QMS. And how you do that, how you know you did that? You document, measure all processes are affected by the update to the 2016 version. There are ways to look at it. You do an internal audit. That's one way to do a gap analysis. and that's one way to ensure you get the implementation of your gap analysis, and one way you ensure your QMSs are meeting the new standard. You do an internal audit to ensure implementation changes have been done. The internal audit will also identify areas that are in need of more attention and audit both the QMS and the gap. So you audit both to the QMS, your process, and also to the gap analysis as well too. You could use the second party audit, which are outside consultants. Okay, that's highly recommended for many reasons. One, you bring in expertise of best industry practices. The second reason is you actually have another set of eyes come in and look at what you're doing. And a final reason is that you say, well, this organization helped us. They can probably even help us into how to fix it. ISO auditors cannot tell you how to fix a problem that you have. Registrar's office for certification. If you bring in the registrar a little premature, they can identify areas of the QMS that needs to be updated. They can come in and say, you know what, you don't even have a complaint handling system into place. That is a finding. Okay? They can actually identify areas of the gap that needed to be implemented at some level. Okay? So you can say, well, you know, we had this in our gap analysis. This is what actually we put in there. But you must be ready for the registrar to come in. This is not the first step. You can't just simply call up, hey, look, we want to go to ISO 1345-2016. Come audit us. They're not going to do that. In other words, it's going to be a problem to even get them to come in there. Audits will provide a roadmap as you put them into the system itself. One thing I mentioned earlier is that how to obtain the ISO 1345-2016. This is the link to get you that, and it'll tell you there how to purchase them as well. I cannot emphasize enough. I have no financial ties to the ISO standard organization at all. I just know that these standards are very useful. I believe in their usefulness. I've seen organizations jump leaps and bounds in many areas just by implementing this standard. Purchase it from them. There are also registrars that will purchase it from them and then they will sell it to you. They are not making a profit, but this is their product, if you will, if you want to call it a product. This is a certification product of their standard. It is very important you maintain a good relationship with the registrar. It is as equally important that you don't maintain a, what's the word I'm saying, a useless relationship with the registrar. Your registrar that comes in there is going to registrar you to 1345-2016. And there are multiple ones that are global. They have global reach. You can have a registrar that's from Norway. You can have a registrar from the UK. You can have a registrar from anywhere in the United States. There are notable different registrars. Some of them specialize in 1345. It's important that you have a registrar that you feel comfortable with, not one that will pencil whip your organization into a certification to the ISO standard. Because although the FDA doesn't measure you against the ISO 1345 standard, if you are registered to it, they will look at your registration certificate. That is part of their audit as well, and it helps a lot in the way what they look at. But this is a link right here. This link right here. That's where you get the standard. So, ISO 1345, 2016. It's now understood by your people, by yourself, by your organization, by your upper management, by your customer base. You have gapped it. In other words, you looked at your organization. You may be at 0. In other words, you may be an organization that is not certified to any standard. You want to go global. You were always FDA was fine with you. Now you want to go global. You gapped it to the fact that you don't have anything. You gapped it to the ISO 9000 series, the old one, 2008, 2015. The gap there. You gapped it to 2003. Now you've found what the difference is. You've implemented those differences. So your processes are now running at 2016 levels for 2019. You've called in your registrar, and you are certified. You get a beautiful little certificate you can hang up in your lobby. You get to put up flags. You get to put up a banner in your place, and you get a good feeling across the company that says, look, we did something. We worked together as a team. We worked together with our suppliers, with our customers, with our clients. We work together with our patients. I had a mentor once tell me, a long time ago when I first started in life sciences, many years ago, he said, we were having failures in the field. And the one thing I can remember him saying was, you know what, it's all about the patient. So if you are certifying yourself to ISO 1345, 2016, you're making a medical device, you're making something for the patient. That patient could be you. That patient could be your loved one. It could be your parents, your child, your spouse, your favorite uncle, your favorite aunt, your grandparents. That could be someone you love. And you make a product that is going to fail and you don't care about. You just want to pencil whip yourself into a certified product. You snuck underneath the FDA radar and someone got hurt or misdiagnosed. Maybe didn't die, life quality of life dropped. Don't forget, when you make something, you're making it for the people you love. I think I came up with 5 minutes left. I was able to go over some of the areas that I said I would have if I have time for. So I did incorporate them in it. The one thing I could do is I have a copy of the ISO 1345 in front of me. Yes, it is an official copy. And I had marked out every number that was the changes were done to it, and I was going to give you every number of every change. That might be a little boring, if you will, but at the same time, it's not that hard to do. You can see the changes in there, especially 2003. So thank you very much for listening. Thank you very much for